Welcome back, students. We are continuing in Modular 9, Mental Health, Substance Abuse, and Developmental Disabilities. This is the third of 4 videos covering Modular 9, and we have spent the first 2 videos reviewing most of the content around mental health, and we are now going to move into alcoholism and substance misuse. I did want to say something, and I should have said it at the very beginning. If these topics, alcohol, mental health, alcoholism, substance abuse, if these are topics and hearing this content is either, operates as a trigger for you because these have been issues maybe that you've had some personal experience with. Maybe it's challenging to hear this information because you've had family members or people that you care about who have been impacted by mental health issues or by alcoholism or substance abuse. Take good care of yourself while you're going through this modular. If you need to, do it in smaller doses, if you don't want to sit and watch all 4 videos at one time, or if you just need to, take some breaks and those kinds of things, give yourself that, because this can be interesting and hard stuff. And particularly if these are issues that you've had personal experience with, then they certainly can be challenging and maybe hard to hear and think about and listen to. So I just wanted to give you that, and hope that you are taking good care of yourself, and that you are finding ways of being able to take in this information in a way that's healthy for you. So moving on, alcoholism and substance misuse. Why do social workers need to know about the issues related to alcoholism and substance misuse? Alcoholism and substance misuse isn't restricted just in terms of the impact that it has on people's lives, is not restricted just to the person who's using the alcohol or using the substance. This is a person who may have children who get impacted. It may be a person who has a spouse or a partner who gets impacted. This may be a person whose parents, are struggling with the fact that this is a person who's having these issues with either alcohol or drugs. So it's important to recognize that even though you yourself may not necessarily feel like, well, I'm not thinking that in my future role as a social worker that I would ever be working in a alcohol or substance abuse treatment program, it doesn't mean that the clients that you do work with, wherever you work, aren't impacted either directly or indirectly by these particular topics. So that's why I think it's so important that social workers know as much about these issues as possible. The other piece is that these are issues that are often directly related to things like child and family difficulties, poverty, criminal justice, and problems in the workplace. As we said earlier, in terms of mental illness, there are some populations that are maybe at higher risk, and those include women, the elderly, people of color, and gays and lesbians. They're at higher risk than other groups for serious problems with alcoholism and chemical dependency. For a variety of reasons, whether we're talking about that as a result of either being elderly or being a person of color, maybe you're impacted from an income standpoint and you find yourself living in poverty, and that experience contributes to your use of alcohol or other drugs. Whether you are part of a disenfranchised community, meaning you may be LGBT and not feel that you can find a community or find support, that can contribute to maybe the overuse of alcohol or other drugs. So there's just a variety of contributing factors that sort of lines themselves up with why these are particular populations that might be at increased risk for these conditions. In the past, excessive use of alcohol and other drugs were considered to be a moral issue. Um, in the past, it was often sort of felt like, well, if you didn't want to drink, you could just stop, couldn't you? Or if you didn't want to take drugs, couldn't you just stop? And what occurred in the 1940s and the 1950s was this concept of alcoholism, particularly with alcoholism, as a disease, that people must be treated in the same way as a person with diabetes or other chronic illness is treated. The prevalent view considered alcoholism to be a chronic condition, which means that it's treatable, but it's not curable. Progressive, it becomes worse if the drinking does not stop, and it can be fatal. It can result in death if untreated. So the concept here is that it's a chronic condition, meaning you will always be an alcoholic. So it's not curable. So very much like if you're a diabetic, you will always be a diabetic. You can manage your blood sugar through diet and exercise and control the disease process, but you're never going to not be a diabetic. It is progressive. It becomes worse if the drinking does not stop. So the more an individual continues to drink, the more potentially fatal it can be. And there's been interesting concepts and discussions about, can a person who's been clean and sober for 20 years have a glass of wine at dinner? And the concept, at least currently in terms of the research, is that the answer to that is no. That a person who is genuinely an alcoholic who has been clean and sober for 20 years, quite frankly, a one drink in after 20 years is much more likely to send them down a path of continuing to use alcohol again. So again, it's that idea that you're never cured, and that, again, that it is fatal because it can result in death if untreated. It's important to recognize, though, that there is still not consensus in the field of alcohol and drug abuse that addiction is a disease. So this medical model and this idea of addiction as a disease is not universally accepted and universally recognized by everyone who's working in the field of alcohol and drug treatment. Again, going back to this disease model, again, increased research supports that alcoholism and substance misuse of other drugs can also be biologically based. Alcoholism and other addictions can be seen as a chronic brain disorder, not a behavioral problem. The behaviors associated with the disease of alcoholism are seen as a manifestation of the disease. So as a result of the brain disorders and the chemical disorder, or the chemical imbalance in the brain that results in alcoholism, results in behaviors that are a result of being an alcoholic. There are terms used in the Diagnostic and Statistical Manual 5, which is a guidance document that's used by people in the mental health field, that categorizes this as a substance use disorder rather than substance abuse. So it's good to start to think about this as a disorder, and to stop thinking about it as abuse, because abuse kind of goes to the behavior piece, and disorder is really more about the medical model. Does this idea of alcoholism as a disease impact the way that social workers might treat a person suffering with alcoholism or a substance use disorder? If you step away from the idea that it's necessarily a choice, or that it's a moral issue, and that they're just bad people, and if they were better people, they wouldn't, then alcohol wouldn't be a problem for them. If you're able to recognize that there can be a physical manifestation to why alcohol operates differently in one person than it does in another person, does that change the way that we begin to think about treating people with that are classified as alcoholics? something to think about. If alcoholism is seen as an individual disease, a family or societal disease, the disease model offers advantages. It might be easier for a family to understand and accept when alcoholism is viewed as a disease as opposed to a weakness or social problem. So if they understand that using the disease model, if that this is a person who's suffering from a disease, like we said, just like any other disease, it may be easier for a family member to be able to lend support. And using the disease model, insurance coverage for treatment and hospitalization can be provided. Drug use can involve illegal activities, often resulting in involvement with law enforcement, and that includes alcohol as well as other drugs. There is less willingness on the part of law enforcement to adopt the disease model in their work with individuals who are misusing alcohol or other drugs. So it still has not become part of the way that law enforcement looks at alcohol and drug use or abuse as that medical model as others have adopted. So alcoholism defined by the use of alcohol that interferes with someone's personal life and shows the following symptoms: craving, strong need or urge to drink, loss of control, not being able to stop once drinking has begun, physical dependence, experiencing withdrawal symptoms, and tolerance, needing to drink greater amounts of alcohol to experience the same high. So again, this craving, not being able to stop drinking once you've started, always feeling like you've got a physical dependence on it, that you need to have it to be able to get through the day, and that your tolerance level is results in you needing a greater amount of alcohol in order to get to the same place that you got the last time. Substance use disorder: alcohol is still the most widely misused drug, but many individuals abuse more than one drug, and that's out of the Substance Abuse and Mental Health Administration. Whoops. Okay. So addiction. So now we're talking about more than just alcohol. We're talking about addiction. And we're going to get to the point where we're going to talk about all the different addictions, and you're going to recognize that this is not necessarily just alcohol or drugs. It's a physical or a psychological dependence on mood-changing substances, including, but not limited to, alcohol, drugs, pills, food, sex, pornography, gambling, shopping or spending, or exercise. For some individuals, they may stop one type of substance but later cross-addict to another substance, drug of choice. So a person may transition and stop using alcohol but start using pills. Somebody may stop using pills and start using food. Somebody may stop using food and start using sex. It's the concept of an addictive personality. Addiction: it's a primary chronic disease of brain reward, motivation, memory, and related circuitry. Genetic factors account for about half of the likelihood that an individual will develop an addiction, with environmental factors also playing a role. So again, here we have genetic factors that are a contributing factor, but if you live in an environment, if you operate in an environment where pills are available, food is available, gambling is available, these may all be contributing factors. Addiction is viewed as an inability to abstain from substance use. It's an impairment of control of behavior. It results in a craving for drugs or reward experiences, diminishes recognition of significant problems in interpersonal relations, and dysfunctional emotional responses to situations. For me, this kind of sums it all up. You're not able to not go gamble. You would not go to work if it meant that you could go gamble. So it's an impairment of control of behavior. Even when you're at work, you're thinking about how you want to go gamble. You, you're not able to pay your bills and you're at risk of losing your job because of the gambling that you've been doing, but you just don't see those as very important problems. And your relationships are suffering as well. And there's also just kind of a, excuse me, dysfunctional emotional response to the situation. So you just don't see it as a big problem, while anybody else who'd be looking at the situation would see it as dysfunctional. Commonly abused substances. What you have here is alcohol, depressants, and narcotics. Alcohol, most oldest and most commonly abused substance. A new trend is this binge drinking, or heavy episodic drinking is a modern definition for drinking alcoholic beverages with an intention of becoming intoxicated by heavy consumption of alcohol over a short period of time. So this is something that's relatively new over the last several years. Basically drinking to get drunk. Depressants, a drug that lowers neurotransmission levels. These are often maybe start with people who have been experiencing chronic pain, such as veterans. And finally, narcotics, drugs such as opium and their derivatives, including morphine and heroin. Narcotics include crack and cocaine. Crack is smokable, low cost, better availability. It's been associated with crime, overdoses, prostitution, AIDS, and homelessness. We've seen the incidence of crack babies occurring. Now, heroin is different in that it's associated with the inner city, poor people, but it's becoming more and more a drug of choice for middle-class youth. It affects the nervous system and often causes euphoria, can result in dangerous and violent behaviors. Stimulants, drugs that stimulate the central nervous system. They may often be legal drugs that have been prescribed, often for people who have experienced an attention deficit disorder. So often you'll find people who are accessing these drugs from somebody who originally got them as a written prescription. There is also, in terms of stimulants, methamphetamine, or what's referred to often as meth, highly addictive, serious side effects. Meth has had an interesting impact on the rural areas in terms of the fact that meth labs are often being located in rural areas to avoid detection. Meth can have an impact on families. It can result in loss of jobs, loss of family income, child abuse, domestic violence, criminal behavior. And it's particularly dangerous to children who are born to pregnant women who use the drug. Hallucinogens include marijuana, which is a hallucinogen is a psychoactive agent which can cause hallucinations, perpetual abnormalities, and other substantial changes in thought, emotion, and consciousness. Inhalants, this is one that often is associated with things like gasoline, freon, paint, and glue. And rofinol, which is also referred to as the date rape drug. It's a sedative and it's been associated with sexual assault. So we are going to stop this video here at this point. And when we come back, we will talk about the social and economic cost of substance abuse.